Introduction. The progress of medicine and healthcare provides people with an opportunity to recognize health problems at their early stages and start treatment to avoid complications. There are many serious disorders and diseases that have genetics as one of the main causes, including Parkinson's disease or cancer. Many medical workers prefer a serial testing strategy to identify possible mutations and predict the development of negative outcomes. Genetic testing aims to identify the changes in chromosomes and genes and prove/disprove a suspected condition. As well as other diagnostic methods, genetic testing may have its advantages and disadvantages that will be explained in this paper. Advantages and disadvantages of genetic testing. The main benefits of genetic testing are connected not with the nature of the results, but with a kind of sense of relief people may have. For a long period, people may stay uncertain in making their healthcare management decisions. Genetic testing gives the answer concerning the necessity to take or neglect several checkups and screenings in some cases. It is a good chance to predict the probability of specific diseases and choose appropriate preventive measures. For example, if a result of genetic testing is negative, a person is able to plan the next stages of treatment without any fears or concerns. Even if the results of genetic testing are negative, certain advantages are observed because people get an opportunity to prevent or monitor personal health. It is possible to begin treatment at its early stage and provide patients with hope and explanations. In many cases, people prefer to be informed about their problems than to live without even knowing about possible health challenges. Predictive medicine and a safe future are the main advantages of genetic testing that people have to pay attention to when they have to decide whether to choose it or not. At the same time, people should be aware of the possible cons of genetic testing and discuss all social and emotional aspects of this diagnostic method beforehand. First, patients have to understand that genetic testing cannot be defined as a type of treatment. The recognition of a disease and its genetic causes at early stages may be a serious challenge for millions of people because they become aware of their problems but can do nothing to solve them. In addition, genetic testing provides only limited information. People can hardly get enough information about all possible symptoms, progress, and consequences of their diseases. They just become aware of the possibility of having a disease, a kind of predisposition, nothing more. Several emotional, social, and financial aspects can be raised. Anger and depression can be experienced by patients who obtain positive results. Some people may feel guilt or anxiety about their results. For example, if the results are negative, some families are concerned about the costs of such tests. Physical risks are also possible after blood samples are taken. Finally, after taking genetic testing, people get the answer to the main question, if they may or may not have a disease. Then, they should learn how to live with such awareness and not make wrong decisions. In many medical cases, awareness is a benefit. However, sometimes, people are not ready for such a portion of knowledge and do not know what they should do with it. Conclusion. In general, the advantages and disadvantages of genetic testing are numerous, and people have to understand that it is impossible to predict the results, as well as to be ready for the information. Serious decisions should be made, and significant steps should be taken by people who use genetic testing. Geneticists have to be ready to cooperate with counselors and protect their patients. Study Corgi can help you make your studies smarter. Visit studycorgi.com for more samples like this, study tips, and writing tools.